I ran out the house because I'm like, oh no, I don't want no dog to come and bite me and then slow down my pace and then sending me to the hospital and then exposing me to rabies and all of those things. Hi everyone, welcome to the channel. Thank you so much for tuning in to the Think Nursing channel, where we discuss everything related to nursing, travel and lifestyle. Yeah, this thing always making this noise. But yeah, I hope you're doing well. Today I'm actually on the road again. It is after 10:30 to be exact, and the temperature outside is like 77 degrees. It's very overcast. Yeah, we've been getting a lot of wind here over the past few days, so I think that's the theme for the week. But nevertheless, I'm still on the road doing my thing. So if you haven't subscribed as yet, I would love for you to subscribe, hopefully, to the channel by the end of the video, or as you go through the the channel itself or the videos. Hopefully you'll see something that is very entertaining for you, or informative, not entertaining, informative, where you'll decide to go ahead and subscribe. But thank you to all the subscribers of the channel. Thank you so much for participating and being a part of the platform. It means so much to me that you've decided to hang on. So I am going to see 2 more patients. So far the day has been going pretty much okay. I went into a house earlier to see a patient, or I went to a home earlier to see a patient, and previously the lady, the patient, she is wheelchair bound, and she also is obese. But the thing about it is that she has a dog. She has 2 dogs. At the time when I saw them, the patient that is, it was like 2 little Chihuahua dog. I'm not really a dog person, so I don't really know the breed of the dog. But she had 2 little Chihuahua puppies. But the dogs them bark loud. They're very loud. So this time, I haven't seen her for the last 2 months because there was some plans for her to move out of state and she didn't want to be seen. So didn't see her for the last 2 months. So she called asking for a visit. So I went in to see her. And lo and behold, when I get to the house, it turned out that somebody had opened the door and said to come in. So I went in. I heard 2 loud barking. So I ran out the house because I'm like, what the hell is going on here? I don't want any dog bite, because guess what? Yes, when you work in 1099, you have to get your own insurance. You have to get everything except patients. So I ran out the house because I'm like, oh no, I don't want no dog to come and bite me and then slow down my pace and then sending me to the hospital and then exposing me to rabies and all of those things. So I was there and I ran out the house. Then somebody came and called to say, oh no, the dogs are in a cage. I said, is it safe to come in? Because those dogs are very loud. It sounds like a very big dog. So anyway, she said, yes, it's safe to come in. They're in a cage. They're, away. So the patient I went in was in the living room. So she was in her wheelchair in the living room. And there were the 2 dogs that are like barking. I honestly wanted to tell the patient that if these dogs are going to be here, because I just didn't feel good about the situation. I was like, if these dogs are going to be here in that tiny cage, because when you look at the cage, the dogs, they reach me at my thigh. That's when I'm standing, and I'm 5'6". So just imagine you have 2 huge dogs in a house that is very small and cluttered. You understand? Just barking. All of that echo is coming back at you. And so I was there and I couldn't get a word out to the patient. Like, I'm there talking and these dogs are just constantly barking non-stop, to the point where she went ahead and hit on the cage with a belt that she has. I guess if they're barking too loud, that's what she normally does. So she went ahead and hit on the cage in an effort to hopefully get the dogs to stop barking. But I literally couldn't get any word in. And I was just there and I'm like, this is ridiculous. Like, this is ridiculous. These dogs need to go somewhere else, or the patient needs to go somewhere else. But then when you look at it, you don't have anywhere to go, because everywhere is like full of clutter. Everywhere is you know, just not appropriate, because the living room we're in, when you look in the bedroom, like there's so many things there that not even the wheelchair could actually go in. And so I was wondering, like, where is she sleeping? Because all the time I've seen her, she was always in the living room. But, you know, the point I'm making is, when you get to homes, you have to be so open-minded. Yeah, you have to be so open-minded about everything, because honestly, as I said, I went and visited before, and those dogs were small. So I can understand, I can do my interview during that time. But just imagine having 2 huge dogs the next time you visit. It was very scary. So, you know, I spoke with her and have her, you know, have some things in place. Because for the next visit, I don't think I'm going to be going there, because I'm not comfortable. Because one, the dogs are very huge. And even though the dogs are in a cage, the cage was like so, the cage just appears so small, because the dogs are standing and the dogs and the cage are basically the same size. And then there was one little tiny thing like a hook that was supposed to be keeping the cage closed. And I really don't think that is doing any justice for the dog or the cage. You understand? So honestly, I don't really feel good about the situation, knowing that next time I'm going to have to go there and be in a situation where the dogs are constantly barking. And I just feel as though, because for the entire time I'm there with the patient, like, it was the quickest evaluation I did. The good thing about it is that I know her, but it was the quickest evaluation I did, because I was just there looking at the dogs. Like, I'm trying to examine her, but every time the dog bark, the head or the back is hitting against the cage. So I'm there just peeping over to the dog, because I am curious whether or not this dog is gonna rush out at me. So anyways, long and short of it is that, as I said, just make sure you observe your environment. You know, if you're not comfortable with something, you know, speak to the patients regarding it so they can make the proper adjustment the next time for the visit. Or, you know, you just do virtual visits if they're not able to accommodate certain things. And always speak with your practice manager as well, because there's no way for them to know what's happening. Because when you say to your practice manager that this is the situation when I go to a home, I do not feel safe, they can address the patient and let them know that we can only continue care with you if this is under control, or this is a situation that is handled differently because my staff is feeling uncomfortable. And so that was it. So I just want to kind of point out that, you know, to you, in the event that you run into anything like this, do not feel as though because you're going to the home of the patients, you know, that overrides your safety in terms of what you feel comfortable with and what you're not feeling comfortable with. So you know, just a little bit of a word to the wise, that's all. But then I went ahead and saw another patient today, and that patient, she's a 96-year-old lady who, every time I see her, she's just always in good spirits. She's always sitting outside smoking, and she doesn't want to use her cane. And the other thing is that she's always in this little short shorts. So I always go and say, you seem like you're on the beach here in Jamaica, because that's the only place to see this kind of shorts being worn. And she starts laughing and she's like, even though I'm 96 years old, I'm not that old, I'm a young girl. I'm like, yeah, I can see, because her shorts is shorter than mine. But anyway, she's looking so good. I always have good conversations with her. So the only problem I want her to do is like cut down on her smoking. And she's like, I've been living for 96 years and I've been smoking for the last 80 something years and I haven't been dead, so I'm not gonna change one thing. So I just started laughing, and I'm like, you know, I'm not really acknowledging what she's saying is right, and I'm not encouraging. My job is to prevent and promote. And even though smoking is wrong, she really has a point. She really has a point there. So I couldn't even say to her, you know, ma'am, go ahead and continue doing your thing. I just say, well, as a part of my plan, the plan is to cut down on your smoking. So you'll find patients who will literally tell you that they've been doing this thing for years, and when you look at them, they're 102 years old, 103 years old, doing the same thing. Sometimes, yes, as I say, you have to just explain to them. You still have to continue with your education and let them know that this is a situation They know definitely it is wrong, but you just have to still go ahead and do your part in playing, you know, the advocate and the educator, and promote to them a healthy lifestyle despite their habits. So she was just always a patient that I look forward to seeing. This time she was complaining about some dental pain, and she had a little bit of a swelling there on her left side of her cheek because of that possibly abscess there under her tooth. So I was saying to her that she needs to go into the emergency room, but you know, everybody have their own treatment and everybody wants to do this and who don't want to do that. So for her, she doesn't want to go to the emergency room because she hates it there, because she's like, every time I go there I'm being admitted. So even though I encouraged her, because you know, we need to know whether or not there is any abscess, we need to know whether or not there is any facial involvement, she refused. So the only thing I can do in that case is document and say that this is what the plan was, because that's the only way for persons to know that you educated the patient about the importance of this, and this is what you wanted, but the patient refused. So as a part of the plan, I advocated for emergency evaluation with possibly CT scan and antibiotic for her, and she refused it. So I just put in brackets, you know, refused. And then I also go ahead to say that I will do an x-ray of the face just to see, you know, if there's anything else going on, and some oral antibiotics to treat that dental abscess, with plans for her to follow up with a dentist as well. So always go ahead and make sure you document what it is that you recommend for your patient, because as I say, if you don't document it, when you go to court, nobody going to know that you discuss it with the patient, and it's only whatever you discuss that is going to be in the chart at the time when you're being called up to discuss certain things, or if you need reference for it. Not because the patient refuses it, it doesn't mean that, you know, it's not a part of your planned regime. All right, so always remember that. Oh my word, it starts raining here. And you know, when it comes on to rain in Texas, everybody tend to not be excited, because when you look the amount of accidents you see on the road, you have to wonder how much rain was falling. So yeah, sometimes it's just a little drizzle. The rain just comes down for 2 seconds, and then you realize there are about 10 different accidents on the highway before you can even get off. So yeah. All right, thank you so much for tuning in, and I do hope that you enjoyed the video. Please remember to go ahead, like, share, comment, and if you haven't subscribed as yet, remember to subscribe to the channel for more. All right, bye.